Hello and welcome back to Psyche Truth. Today I will be doing a massage on scoliosis and specifically the spine. So let's go ahead and get started. First, I'm just going to glide down the area with light pressure, not trying to shift anything, just tuning in to Lauren's spine. Scoliosis is very interesting. Sometimes the cases will have more of a snake spine. Other times you will find somewhat more like Lauren, where there is an actual rotation happening. So in that case, we're just going to notice, say hello, and get her nervous system open, calm. I don't want to force her spine back into a straightened position. Forcing a spine that doesn't find center as home can be very painful and uncomfortable. I more so want to connect to the fascial webbing of her core, of her back, and see if there's any way we can get that web or structure to shift. Sometimes, because of the imbalances in scoliosis, you might work one muscle on one side that is not as developed on the other. That's very, very normal. That's what makes it a bit of a unique massage. So I'm going to attune to this right side. As we can see, the spine itself is rotated a little bit back, which makes this right scapula sit farther back than the left. So in this case, if we know that the muscles are having to hold this scapula farther back, then the muscles in front that are the antagonist to this area are probably doing a lot of work and very short. So to get the most shift in this rotation in the spine, I'm going to lightly leave my hand on her scapula to see where it wants to shift, and then draw slow, smooth glide across the pec to go ahead and open it up. You should end with your fingertips right under that anterior deltoid. And then I'm just going to petrissage. And now I'm going to find that scapula and follow it all the way to the edge of the bone. And feed that fascia into the opposite direction. And once again, cupping my fingers right underneath the collarbone and pinning down the rhomboid and a straight, smooth glide across the pec. And I'm going to petrissage the trap. It's where a lot of tension likes to be held. We all know pain likes to live there. And I'm going to integrate this down into the lower parts of the spine. Just because you cannot visually see the imbalances of a scoliosis patient, in certain areas, the twists and the turns of the spine impacts the entirety of the spine. So it's nice to kind of integrate whatever shifts you have going on back into the rest of the body. Remember, the neck is a part of the spine. It too can have twists, turns, and balances. In general, I find that scoliosis tends to create headaches. And typically, in my experience, it is accompanied by a lot of anxiety. So getting massages for your condition can really help a multitude of areas in your life. Also, learning to work and articulate your spine one vertebrae at a time through things like a spine stretch, even things like pelvic tilt in Pilates or hollow body and functional movement can help strengthen the intrinsic muscles right in the front of your spine to help better support alignment and just help to better support your spine in general. Feeling a lot of tension in Lauren's neck, so I'm going to just use my fingertips, thumb, and usually the middle to ring finger to work that tension in the back of the neck a little bit. Make sure not to pull any hair. Even though there's a rotation and kind of a holding of this scapula farther back than the left, I can feel the ramifications and the tension of her left trap. It feels different than the tension in her right. And really, I'm tracking the erector muscles of her spine. These erectors can get pretty tight and carry a lot of tension and soreness. So it's nice to tune into them, especially on a scoliosis patient. Many times you'll find imbalances in the erectors of your scoliosis patients because one side will have a curve, the other side will stretch. It's nice to tune in and let them feel that. Feel the proprioception. The brain likes to tune out things that are uncomfortable. So proprioception and palpation can help it tune back in and feel the space more accurately. And I can feel this left QL is much tighter than the right. So I'm doing a little bit of pressure with the heel in my palm. And if there is enough tissue there, if they're not sensitive, you can use your thumbs to come in and trace that iliac crest. And now I'm going to come back and tune in to the right side because that twist is more prominent on this side. I want to see if anything has shifted. I'm also going to come back and tune to that pec. A little bit of the scalenes at the same time. Hooking my fingers underneath the collarbone and lightly, smoothly dragging across, opening up that shoulder and pec. I'm not trying to force as much as encourage, guide. Going back into the trap. Create some length here. And smooth, long stroke down that right erector. Sometimes, like I said, with scoliosis, you'll do one thing to one side and not really have to do it to the other. Creating traction from below, I'm going to drive the heel of my palm into her lower back and simultaneously cup my hand underneath the bottom of her skull and drive them away from each other. Light pressure on the skull, light pressure on the lower back. And I'm going to do it from this position now. So I'm going to go ahead and drive the bottom of my palm into her lower back and cup the sharp end of my hand underneath her skull to pull them in opposite directions. And this one particularly is my favorite. Using my fingertips, I'm going to just clip on to the fascial tug of her spine. Not a lot of pressure down, as much as pulling and gliding those fingertips up the spine to pull on that fascial connection and give her some really deep traction. And I can travel all the way up to that bottom of the skull and continue to pull. All right, and that concludes our massage for today. And I have a quick shout out to our patrons, Junaid A., Ryan S., and Jessica A. Thanks for watching this video, you guys, and I will catch you next time.